Welcome to the Birth Squad, the podcast designed to empower birthing individuals with real insights from two Black female physicians. We're here to guide you through your health journey, one episode at a time. I'm Dr. Kamisha Thomas.
And I'm Dr. Ijama Bello. We are two OBGYNs and longtime best friends, and we're here to help navigate you through the world of reproductive health.
Real women, real stories, real experts, and the facts you need to know.
Tune in every other Sunday, and don't forget to like, follow, and subscribe.
Ready to join the squad? Let's get into it. Welcome back to the Birth Squad, the show where pregnancy, delivery, and postpartum gets the spotlight it deserves. I'm Dr. Kamisha Thomas.
And I'm Dr. Ijama Bello. And today we're talking about that moment in pregnancy when you ask the question, is it time or is it just a leak?
Yes, we're talking about rupture of membranes, specifically when your water breaks before contractions start. Learn the signs, the risks, and what to expect when things don't go as planned. Spoiler alert, it's not always as dramatic as it looks in the movies.
So please be advised that the topics discussed in this episode may be sensitive and could be triggering to those who have experienced birth. Listener discretion is advised. Now let's dive into this week's episode.
Well, welcome back to another wonderful episode of the Birth Squad. It is our honor and privilege to share with you a story from one of our very dear friends from college, Morgan. We go way back. But Morgan, thank you for being on the Birth Squad. We wanted to start by asking you to introduce yourself and share a little bit about who you are.
Yeah, thank you guys so much for having me. I'm Morgan Antwine. I'm an attorney for a technology company, and I'm based in Atlanta. And I live here with my husband, Mario, and my 3-month-old son, Maverick.
So, Morgan, tell us a little bit about your journey to motherhood.
Yeah, I mean, my journey to motherhood, I almost thought I would never make it here, if I'm being honest. I did not meet my husband until I was 33. I think. So I think once you get to a certain age, you kind of have to have realistic conversations about like, am I going to meet someone? Is this going to happen for me? And then I had just gotten to a place where I was like, I'm going to enjoy my life. Either way, I'm happy all by myself. And then I met my husband, which is how I think it like happens for a lot of people. And so we got married a year after we met. And then because of my age, we thought that we should start trying. A lot of people told us that it would like take several months probably to get pregnant and that I'd maybe have to go through fertility treatments because of my age. But that was not the case. We actually got pregnant very, very, very quickly. And so I feel like I didn't even have time to like think about it. It kind of just like happened. And then I just had to like fall in line.
So then what was your pregnancy experience like?
I had a really good pregnancy. I didn't have any complication. I think in my second trimester, I had like a little bit of sciatica, which was like a fun surprise to wake up to. And then I think in my third trimester, I started to feel like a lot of like pelvis pain. So that was an experience like all its own. But other than that, I wasn't really nauseous. I was tired. I think a lot of people get tired, so I don't think that's abnormal. But overall, I was just trying to be happy because my mentality was like, if I'm happy, the baby's going to be happy. I'm going to try and transfer that energy. And so I just worked really hard to make sure that I wasn't, stressed. And fortunately, my husband is fantastic, and so he helped manage all of that too.
Morgan brings up sciatica and pelvic pain, but what exactly is she talking about?
Well, sciatica in pregnancy is that sharp shooting, oh my goodness, my leg just betrayed me pain. It happens when the sciatic nerve, the longest nerve in your body, gets compressed or irritated, usually thanks to a growing baby who thinks your spine is a hammock.
Right. The sciatic nerves run from your lower back down through your hips and buttocks and down each leg. When it's irritated during pregnancy, it can feel like lightning bolts shooting through your backside and legs. Cute, right?
No, not cute at all. But how common is it? Somewhere between 50 to 80% of pregnant women actually experience pelvic pain, and sciatica is one of the culprits. Though true sciatica is less common, pelvic girdle pain and round ligament pain often get grouped into the same category.
So what can you do about it? Let's break down the Birth Squad's sciatica survival guide.
All right, step 1. Posture is power. Sit up straight, avoid slumping, and try using a support pillow for that royal booty. Your butt deserves a throne.
Step 2, heat and ice. Alternate between warm compresses and ice packs on the lower back or buttocks. It's like a spa day, but you're crying a little.
Prenatal yoga or physical therapy, especially with someone who understands pregnancy-specific pain, like Lynn Schultz from our episode this season about pelvic health. They'll teach you how stretches like cat-cow, pelvic tilts, and other positions can really help. Plus, it's a great excuse to roll around on a yoga mat without judgment.
Step number 4 is to sleep side-lying like a side-lying queen with a pillow between your knees to keep those hips aligned and happy.
And step 5, talk to your provider. Sometimes pain can be a signal something more serious is happening, and you might need a referral for physical therapy or other interventions. Now let's get back to Morgan as she talks about her delivery expectations and her experience. So now, Morgan, this was your first pregnancy, and so obviously it was, a totally new experience for you. So what was kind of your expectations or preconceptions about labor and delivery before you actually even experienced it for yourself?
Not have any expectations going in. My personality is usually like, I like to be prepared for everything. I read everything. I have plan A, B, D. But with pregnancy, for whatever reason, I treated it very differently, where I was like, I don't want to know what's coming next, because that would just like spiral for me. And so I had gotten a couple books for things to like read about, but I didn't really do too much planning or have too much like expectations. Like people kept asking me like, what's your birth plan? And I was like, getting the baby out, like that's all I'm worried about. And so I remember asking my doctor, what do I need to do to prepare for like delivery? And she was like, nothing. And I remember actually calling Ijama and being like, my doctor told me, there's nothing I can do to prepare. And I remember you telling me like, that's kind of true. Like things happen as they do. So sometimes when you over prepare and you overset your expectations, it can become very difficult if things have to change so rapidly. So I feel like I just tried to embody that. And I was just like, I'm going to go with the flow and we're just going to see where the day takes me. And I treated every day of my pregnancy like that.
I think that's a great strategy, right? Like I tell patients all the time, if your birth plan is just to have a healthy, happy baby, that's still a birth plan, right? It doesn't need to be 6 pages. And I think that's completely valid. So you said you took each day as it came. So then why don't you tell us about the day? What was that experience like?
Yeah, the day. So it was actually the week that I was due. And my husband's family was in town. And so we had like some people at the house and we were like hosting a little bit. So I was like running around all that day. And it's finally nighttime. And like this is the time of day that I look forward to because by this time I had like so much pelvis pain that I was just like, I'm gonna plop on the couch and not do anything. TMI, but I like went to the bathroom because at this point in pregnancy, you also like my bladder. So I was feeling like I was always going to the restroom. So I like went to the restroom. I like, got up and went to go sit on the couch and I was like, it's like, I feel a little wet. Like maybe I was just like rushing or not paying attention. And I just describe it to people like, I just feel like the last 9 months have been like, we're just like nuts, right? So much is happening to your body that I was just like, like, here is another thing. I don't know what this is, but okay, I must be, moving too fast when I have to use the bathroom. And so I think it happened like a couple more times throughout that night where I was like, I went to use, and it was always after I went to the bathroom. So I think that's why I was like so confused, where I would come out and then I'd be like, I need to change my pants. I think, like something's weird. And I remember turning to my husband at the time and I was like, do you think, like, should I call my doctor? Like, do you think this is okay? And he was like, we'll call her in the morning. This seems fine. Like, it seems fine. And I think part of that also is because I had a friend who recently had a baby and she had said she knew she was going into labor because she felt these like very heavy contractions that came from like the back to the front. And so we were like, okay, back to the front contractions. That's how we know. And I didn't have that. It was just like, I felt like a little bit of wet. And then I felt fine. I didn't immediately feel contractions or pain. So we just thought, I'm just thinking this is normal. And so we went to bed that night. And at this point, I had like mild cramping. They kind of felt like menstrual cramps, but this wasn't unusual. I had been feeling that for like the past month. Apparently, that's your like body's way of getting ready. That's that's what someone told me. So I'm like, okay, this is all like very typical. So my husband goes off to the gym. I'm like, oh, I guess I should call my doctor. And so I like call the office. She like calls me back and she's like, well, since you said you had to change your pants, like, let me just meet you at the hospital. Let's like just go. And so, my husband comes back for the gym and I'm like, baby, we gotta go to the hospital. We hadn't even installed the car seat. I had my bag packed. My husband hadn't packed his bag. So we were just like, okay, we think this is a false alarm. They're going to send us home. Let me just we'll put the car seat in the car. I'll grab my bag and we'll just go. And then we went to the hospital and then things just progressed so quickly after that.
So it sounds like you experience, your water breaking. And rather than it being like what we see in the movies, where it's this like big old splash, you kind of have like a trickle that you weren't quite sure if it was urine or your water breaking.
Exactly. That's what I was expecting. Like the movie, you like get up and everything just comes like out of you. And that just wasn't my experience at all. And then I also thought that I would like start to feel pain immediately. And I didn't feel anything that felt out of the ordinary for my pregnancy either. So I'm just thinking that this is just like, also, I think I read that there's also something, this may be like a little bit gross, but like you have like a mucus plug. I didn't see any of that either. And so, the signs that I was like told to look out for, I didn't necessarily see.
Exactly. Yeah. So how was your water breaking actually confirmed? How did they confirm it?
Yeah, so we went to the hospital. I didn't even bring my bag upstairs because we were like, they're gonna send us home. This is whatever. This is just a precaution. And we went into the room, and the nurse at the time did some type of like test with her, like when to feel the baby to see if there was like amniotic fluid. Not sure what any of these terms are for any of this stuff. And so she did that test, and she couldn't tell. But based on her initial reaction, she was like, I think you're fine. And so I was like, okay, this is what I thought. I'm going to be sent home. By this time, my doctor arrives at the hospital and they do some other tests where I think they take a sample to see if there's like amniotic fluid present. And so she did that. She left, and my husband and I are like, we're going to go home. The first test, they would have known. And then my doctor comes right back in and she goes, yep, it's amniotic fluid. Let's go. We're moving you to delivery. And I was like, wait. Like, what do you mean you're moving me to delivery? And she was like, we're going to put you on Pitocin and then we're going to get this party started. And I was like, Pitocin, my mind's like, oh, that means I'm being induced. I don't want to be induced. Do I need to be induced? But because all of this had happened, the night before, like the waiting period for kind of labor to kick in on its own, I was like past that time. And by this time, they were referring to what happened to me as like a rupture. So it was very clear that like, I needed some sort of like medical intervention by then.
Okay, Birth Squad fam, let's get into it and break down some of the things that Morgan describes. That magical, mysterious moment known as rupture of membranes, aka your water breaking.
Or, as many people experience it, the sudden moment you're standing in Target wondering if you peed yourself, if it's amniotic fluid, or if it's your bladder that just gave up on you.
So let's break down the lingo first. You may hear SROM or SROM, which stands for spontaneous rupture of membranes. This is when your water breaks naturally during labor. Or you might hear PROM or PROM, which is pre-rupture of membranes. This is before labor starts, and this is what Morgan describes.
And then there's PPROM, which is preterm, premature rupture of membranes, when your water breaks before 37 weeks. That's a whole different level of attention and care.
Now, here's the thing. TV has lied to you. Your water breaking is not always a dramatic whoosh that clears out the Whole Foods checkout line.
Exactly. It can feel like a big gush, like someone dumped a water balloon between your legs, or B, a slow trickle, and you're not quite sure if it's fluid or if it's your bladder just being rude, or even just like a wetness you notice later, like, hey, did I sit in something?
If you're like most people in late pregnancy, you're already leaking all kinds of things, so it's confusing. But don't worry, there are ways we test for this.
Yep. In the hospital or clinic, we can check using something called the nitrazine test. It's a little strip of paper that changes color if the fluid is alkaline, like amniotic fluid. There's also a ferning test, which is when we take a sample of the fluid and look under the microscope, and it shows a ferning pattern if it is amniotic fluid. And then there's also a speculum exam. We take a speculum to visually check for pooling inside of the vagina. And then ultrasound sometimes is used to assess fluid levels to just make sure everything's okay.
So, what does it mean if your water has broken? If you're full term, like 37 weeks or greater, and you're not yet having contractions, it means that labor is coming soon, but it just hasn't started yet. If you're already in labor, then congrats, your uterus is moving and shaking. If you're not in labor after a rupture of membranes, we usually don't just let you hang out forever though, because once that bag is open, the risk of infection starts going up.
Which brings us to the legendary Pitocin. If your labor doesn't start within a certain window after your water breaks, usually 12 to 24 hours depending on your provider, you may be offered Pitocin to help move things along.
But listen up. If you're having a home birth or birthing at a birthing center, your midwife will also have a clock ticking in her head. Most follow similar guidelines. Some may give you time to rest, hydrate, do natural labor-inducing tricks, but eventually, if labor doesn't start, you may be transferred or offered other interventions.
And now let's answer a big myth buster. Do you always pass your mucus plug when your water breaks? Nah, that plug is sneaky. Some people lose it days before labor, some lose it during labor, some will never see it at all because it's mixed in with everything else that's going on down there.
And by the way, if you're leaking fluid and it's green, brown, or has a strong odor, don't wait. Call your provider. Your baby may have past meconium, which I tell people think of it as the prenatal poop smoothie that your baby's been cooking up. Or there could be an infection.
Last thing, when should you go to the hospital or call your midwife? One, if you think your water broke, you should definitely call. If you're GBS positive, you usually want to go in sooner because you'll need some antibiotics. You should also call if you're having contractions already. That's great. And absolutely call 911 if there's a cord hanging out. This is a prolapse cord. If you're having bleeding or your baby's movements decrease, go in immediately. That's an emergency.
Great advice, drama. Okay, let's get back to Morgan's birth story. Listener discretion is advised. Yeah, I mean, like Ijama was saying, like the movies kind of portray it in one way. How do you feel like your experience changed your perspective?
On what I see in the movies.
Yeah, just like how do you feel like with medicine in general, right? Like we see labor kind of portrayed in a certain way. Now you've experienced it. How do you feel like what's your perspective? And then also, what would be some advice that you would give other people who might be anticipating having babies as well?
Yeah. I would say for your advice, if something feels off or different, which is hard because almost everything feels off or different, call your doctor just to be sure. Because I very easily could have just stayed at home because I wasn't having enough symptoms or cramping enough to think that I was like, my body was like kicking into like the next gear. So I think you just have to like know your body, pay attention to your body as much as you can. And then hopefully you have a healthcare provider that you can go to where you can ask questions, you know, and they listen and be like very candid. So that would just be my advice.
So Morgan, I know for you, as you were going through pregnancy and everything, you were kind of like, just whatever happens, happens type of feel, right? In general, it sounds like you were kind of relying on whatever knowledge you had taken in during your lifetime. Do you feel like there's enough education or just like talk about these types of things so that someone can feel a little bit more, you know, prepared for birth and
Not
pregnancy?
I mean, not really, right? Because I've already, from my experience, I know what you see in the movies isn't exactly like accurate. And I tried to take the time when I went to my doctor's office to like kind of like find out the next steps. And I had a great doctor, and I feel like she did a good job of always telling me like what's next, what's at the next visit, what to expect. But for a lot of just like the weird pregnancy things that you feel, you don't necessarily know it's coming. Like this sciatica feeling that I had came out of nowhere. Did not know that that was like a pregnancy thing. I thought it was because I was exercising, and I was like, oh, did I like pull a muscle or something, before I realized that it was like probably somewhat pregnancy related. Yeah.
Yeah, it's hard in pregnancy because everybody's going to have different symptoms, right? Even every pregnancy can be different. So it's hard to anticipate what you may or may not experience. You know, sometimes we try to give people information, but some people are like, that's too much information. And they're like, want to kind of approach it as it occurs to them. So I think, you know, trying to get credible sources of information, asking your doctor, like you mentioned, is a really good place to start. And then also to advocate for yourself, because I always tell patients, if you're unsure, just come in, right? Like just go to the hospital. Well, like if you don't feel your baby move, just show up. We're never going to be mad at you for being there, right? So I think that's also a really important piece of what, you know, we've been talking about today. I want to shift gears just a little bit and ask you about your delivery experience, if you're okay with sharing that with us so we can kind of get a clear picture of what happened after your doctor's like, we're being admitted, we're starting Pitocin.
Yes, so I was moved into the delivery room. You know, they put me on an IV. I think next step for me was I knew that I wanted to get an epidural, but I'm terrified of needles. So I was like, I didn't know if I was more afraid of the labor pains or like the needle, to be frank. And so I was feeling more and more contractions, a little bit more pain. And I just remember the nurse being like, do you want to get, your epidural now? And in my head, I was just like, I don't know when I'm supposed to get this. She's like, how bad is the pain? I'm like, six, like I don't even know how to quantify it. I'm like, how bad is this gonna get? I don't know. Like, is it going to get much worse, or this is kind of bearable? Is this the worst? So I don't know, but I went ahead and I got the epidural, and things changed dramatically after that. I love the doctor who put it in. I didn't feel a thing. Did not feel a thing, did not see the needle. And I just felt that kind of like relief, like instantly once that happened. And then in terms of time, I just feel like things moved so quickly from there. When they had checked me when I like first came in for triage, I think I was like 1 centimeter dilated. And we thought we were going to be there for a while, right? Like I didn't know how long this was going to take. It was probably like late afternoon by this time. And so I had even called my parents, and my dad was going to come and switch out with Mario so he could like, my husband, and get a bag. And so right as my husband is about to leave so that my mom can be in the room with me, they decide to check me again. And by this time, I'm like 9 centimeters dilated. And I'm like, what? And Mario's like, to the nurse, he's like, so I guess I shouldn't leave. She was like, no, you're not going anywhere. So we like call my parents, and we're like, change of plans. And they're like rolling in the delivery table, with all the stuff. And I'm just like, what? And I see the stirrups go up, and I'm like, what? Like, what? This is nuts. I mean, it happened what felt like fast after that process of getting the epidural, that I feel like I didn't even have time to like process or think. And before I knew it, I was just pushing. Like my parents at one point, like they came into the while I was like delivering. I don't know, because I like wasn't like I had no plans for them to be in the delivery room. But there was just like so much going on, and I was like trying to push. And so I pushed for about an hour. And then before I knew it, everyone's like, we see the head, we see the baby, and they pull the baby out and they put him on my chest. And I'm just like, just trying to process everything that's going on in that moment. And then things kind of like changed for me. Everything, my pregnancy was very, I would say, like pretty easy up to this point. My delivery was like, seemed fast and easy up to that point. And then I just remember like looking up and just looking at my doctor's face. And it kind of, the room kind of like changed for the medical staff, where it that feeling of like happiness and like here's your baby, to I could feel like just a more serious tone. And I was like, okay, like, what's going on? I could see her like very intently focusing. And so that's when I knew that like something was amiss, something had, gone out of the ordinary. And from what everyone like tells me, I was losing a lot of blood just very, very quickly. I turned like very white, started shivering, all of that stuff. They tried, I think, packing me at one point and stitching me up, and that wasn't working. They eventually ended using some type of machine. I don't know what it's called. You guys definitely know what it is. They refer to it as like a Jada, and they put that into my uterus. And as I understand it now, my uterus was not hardening back up after delivery. So they were like, like, I guess pushing on it, and instead it was just like blood flowing out. So they had to stop the bleeding immediately. So that was definitely something I was not prepared for, did not expect, just felt the panic because I'm like, this is the best moment of my life. I have my baby on my chest, and, you can see the medical professionals in the room just taking it all very seriously. And so fortunately I had my husband there, and I just kept looking at him because I was just like, like I was just trying to look into his eyes to be like, is this, is it okay? Because I couldn't really see, is this okay? Like, what is going on? And he did just a fantastic job of just like keeping me really, really calm. And then I found out, of course, what was really going on a little bit later the next day.
So, what Morgan described is actually the leading cause of maternal complications around the world.
Yep, postpartum hemorrhage is when you bleed too much after giving birth. Now, bleeding after delivery, totally normal. You just had a baby, your uterus is clearing house. But a postpartum hemorrhage, we're talking about blood loss that's excessive or dangerous.
But let's get specific. It's defined as 1,000 milliliters or more after a vaginal birth or C-section, or any amount of blood loss that makes your vitals become unstable and causes symptoms like dizziness, weakness, or low blood pressure.
And there are two types. There's an immediate postpartum hemorrhage. This happens within the first 24 hours after delivery. And there's a delayed postpartum hemorrhage, and this can occur 24 hours for up to 12 weeks postpartum. Yes, even weeks after birth.
And the most common cause is that the uterus won't contract, which is called uterine atony. Basically, the uterus is like, nah, I'm done working today, and it doesn't clamp down to stop the bleeding. This is exactly what happened to Morgan.
Other causes? Well, let's break down the 4 T's. The first T is tone. Like we said, that's uterine atony, and that's what Morgan experienced. The second T is tissue, so retained placenta or blood clot. The third T is trauma, so tears or lacerations in the vagina, cervix, or perineum, which is that space between the vagina and where we poop. And the third one is thrombin, so blood clotting issues, which is usually very rare, but can be very serious.
Yep, so the big question is, what should we do about it? Let's say it's uterine atony, so we grab our trusty medications, which are uterotonics like Pitocin, also known as oxytocin, misoprostol, hemabate. All of these help contract the uterus. We also do uterine massage. Yes, it's very uncomfortable, but it's effective. We also empty the bladder because a full bladder can block the uterus from contracting down. And also we do something called tamponade, which is using pressure. This is using a balloon known as a Bakary or a Jada, which applies pressure into the uterus. A Jada is what Morgan had.
Now, what do we do if there's retained tissue? Well, the provider might need to do a manual removal or even a D&C, which stands for dilation and curettage, to clear the uterus.
And if it's trauma, like a tear, it'll need to be repaired surgically right away.
In severe cases, we may need IV fluids or a blood transfusion, and that's if you accept them. Or in very rare circumstances, we might need surgery to stop the bleeding, which can include a hysterectomy.
So what about delayed postpartum hemorrhage? It's often from retained tissue or infection. So if you're at home and suddenly start soaking pads, passing clots the size of golf balls, or feeling weak, you got to get checked immediately.
Unsure if it's normal or concerning? Then remember, bleeding that soaks a pad in under an hour, dizziness, fast heartbeat, feeling faint, call. Fever with bleeding, also call.
This is not the time to tough it out. Postpartum hemorrhage can come on fast, and the sooner it's treated, the better the outcome.
And listen, if it happens to you, it is not your fault. You didn't fail. Postpartum hemorrhage can happen to anyone, vaginal or C-section, first time or fifth time parent. Okay, now let's get back to Morgan and hear what advice she would like to leave us with.
What an experience. Yeah, thanks for sharing that. What you experienced, the postpartum hemorrhage, is like the most common complication of childbirth. So I'm just so happy that your team was prepared and they were just doing what needed to be done, and that you're here to tell us about the experience, right? So yeah, with all of that, how do you feel like this whole experience has like changed your perspective about pregnancy, childbirth, motherhood?
Yeah, I mean, all of it is a testament to just like how strong a woman's body is and how just like it's just like amazing. Things you did not think you could do that you just have to push through is just absolutely amazing. And that like I feel like that's just like all I can say. Like just like going through it now, I don't even have words for the experience because it's just crazy to see how things progress, how your body adapts to it, how you mentally start to prepare and adapt for it. And I think I was also very fortunate because I had a good, solid group around me also to make sure that I was feeling good my whole pregnancy. But yeah, it was nuts.
I know it's hard. Like pregnancy is it's hard. It's this like unknown territory and it's hard to know what to ask, where to get information, and what to expect because everybody's experience is so different. So, what would you tell people? Like this is what worked for you, but like what advice would you give to other expectant mothers? And it could be about pregnancy, labor, delivery, or even postpartum. Like, what advice would you give them? And is there anything that you would recommend they discuss with their healthcare providers?
Yeah, I think for women, you have to know yourself. Like no one can tell you how it's going to go, how you're going to receive it, what's going to happen. And so you just have to do what is best for you. And in my case, that was taking it day by day. That may not work for someone. Someone may feel like they need to have a wealth of information. I had a couple of other friends who were pregnant and they were just like studying everything, knew everything. And that was just a different approach than what I decided to do. But I think at the end of the day, it comes down to what you think is best for you and your mental health during your pregnancy journey and having a good, medical team or team of people where you can ask questions as things kind of like come up during your journey as well. In terms of labor and delivery, I was just really happy I was in a hospital, to be honest, just based on my experience. I'm just very glad I was in the hospital. I don't even want to think about what would have happened if I was in a home birth or didn't have the medical, care that I needed right on site at that time. I wasn't like in a great condition to be transported, so I just can't imagine what that would be like. So I am very much a fan of modern medicine, very happy for it. And I love my doctors after all of my experience. And then postpartum, that is something else. That is something else. I will say that postpartum has been harder than pregnancy for me. As so many people call it like the fourth trimester, that is accurate. It's just like an extension, but it's just so much going on, so much recovery, but you have a baby that you need to care for. It's just a lot. I don't think I have all the answers for that. I'm still trying to figure that out myself and get kind of back in track and back to where I was before. Postpartum is also a journey, and I don't think that that's talked about enough. And by that time, you're not really going to the doctor as frequently. So you very much can feel on your own, even if you have family close and everything. It's just a different experience.
100% Morgan. Yeah, you are so right. We emphasize that a lot on the podcast, and because it's such a, like you said, unknown territory and everyone's experience is different. But one thing that is common is that postpartum fourth trimester is, it is hard. Yeah. Is there anything else that you would like to share with the listeners?
I don't think so. Thank you guys so much for having me and letting me tell my story here. Thank you for being a phone call away for when I had questions. I just appreciate you both as doctors and as women. You guys are just fantastic. For those who didn't know, we were on the same floor. Is how we met our freshman year of college. They were roommates and they were in the next door down. So it's just amazing to kind of see where all of us are now. And I love you guys. I'm so proud of you.
Oh, love you too.
Right back at you. We're very proud of you as well, girl.
Thank you for being here.